successful dentist means finding the methods and tools that make us confident to deal with all the unique cases we will see on a day-to-day basis. And with younger patients, a dental procedure can be especially worrisome with something as intricate as a root canal. Hi, I'm Beth Damas. I'm an endodontist with a busy practice outside of Chicago. And while many practitioners tend to avoid the challenges of endo procedures on younger patients, I've actually migrated to them. I feel like I can have a positive effect on their dental health later in life. Through my years of doing these cases, I've discovered several tools to help these go smoothly, and I'm happy to share some of those with you now. Beginning with the first meeting, I recommend scheduling a consultation appointment for anyone 12 or younger. This allows you to establish a relationship and build trust with the patient and the guardian. This is a crucial element in establishing rapport with younger patients. It will help to put them at ease. During any conversations, sit at the same level as your patient. Facing them and maintaining eye contact helps them to relax. Keep the room free of instruments and equipment during the consultation, so that you have their attention and do not intimidate them. Invite them to express their fears or concerns by asking open-ended questions. Asking them things like, what was the last thing your regular dentist did, and how did it go, will provide great insights into their fears and concerns. When it comes to the actual clinical appointment, I use a show, tell, do approach with every step of the procedure. You want to show the patient what you are going to do before actually doing it. If you are going to tap on their tooth with a mirror handle, explain it to them in a way they can understand you. Say things like, I'm going to use this handle to tap your tooth because my fingers are too big for your teeth. Then tap their finger first so they know what to expect. Endo ice tests can be scary to a small child. Reduce their fear by telling them you need to see if their tooth can feel cold snow. Again, touch their finger first with the saturated cotton pellet so they know what to expect. Removing the mystery from their mind will help put them at ease with this step. Once your diagnosis is complete and it has been established that endodontic treatment is necessary, explain to the patient that their tooth is sick. Tell them you're going to help them make it better. Keep the technical terms out of your conversation with the child. Only use dental terminology with the guardian once the child has left the room. When it's time for the treatment, let them know that the tooth will be put to sleep so you can work on it properly. Keep the child engaged during the procedure. Beginning with topical, show them the jelly on the Q-tip. Touch it to their finger. Let the topical saturate the area for an even longer amount of time than you normally would with an adult. Anesthesia can be potentially the hardest part for any patient. This is especially true for children. Because of this, the injection syringe is the only piece of equipment that I do not recommend showing the child. After you remind them that you will put their tooth to sleep, let them know that they will feel a little pinch for a second. But then the tooth will fall asleep quickly and they won't feel anything. I like to ask them to close their eyes and open wide. Tell them that the first thing they will feel is your finger inside their mouth. It helps to have your assistant holding their hand during the injection. Tell them the sleepy juice is next. Inject it slowly. Buffering the anesthetic with a bicarbonate solution also helps to minimize the sting associated with the anesthetic delivery. If you need to administer a second carpule of anesthetic, wait 5 minutes so the first carpule has had ample time to numb the gingival tissue. When it comes to placing the rubber dam, give the child one first. Let them feel the material. Tell them that this raincoat will be on their mouth to protect the tooth during the whole treatment. After placement, the child might be a little scared. Give them a mirror so they can see what they look like and reinforce that the raincoat keeps all the other teeth from getting wet with your cleaning solutions. Before you begin working on the tooth, retest with endo ice to make sure that they can no longer feel the cold. Establish a safe signal with the child that they can use at any time they need you to stop during the procedure. Raising their hand is a good one. Moving on to instrumentation. Before the high speed ever touches the tooth, it helps to run it in front of the child. Let them hear the sound and see the water spray. I like to put a burr in the handpiece during this. I tell them it's a metal brush. I always spray their hands with the water from the high speed so they know what to expect. Tell them you need to clean all the germs out of the tooth so it isn't sick anymore. When you're ready to deliver irrigants to the tooth, show them the irrigating syringe and tell them it's not a shot, but a water gun to help wash the tooth. Squirt a little out so they could see the fluid release. Constantly talk them through the procedure so their curiosity doesn't wander. For example, when you stop to change burrs, tell them you're getting the next size brush ready. As you irrigate, inform them you're rinsing everything away from the tooth. During x-rays, let them know you are taking new pictures to make sure there are no germs left behind. At the end of the procedure, print a final x-ray of their tooth for them to keep. Small prizes are rewarding for appointments that have gone well. There are some other general ideas that may help you with any nervous patient. First off, consider using the same assistant that was present during the consultation appointment for the clinical visit. This will reestablish familiarity with the office when they arrive for their procedure. To make the actual procedure more comfortable, advise the child and guardian that they can bring headphones and music to listen to during their appointment. If you provide music in your office, it would be wise to invest in child-size headphones. Dark sunglasses can also be helpful. This will keep their eyes from being exposed to the harsh lighting from microscopes. Keeping all of the instruments and equipment covered up and out of direct eyesight of the child can ease any fears as well. Remember, during each step of the root canal procedure, I find employing the show-tell-do approach really helps ease concerns. I've had good success with pediatric endo cases by employing these tactics. I find they help children and their guardian be more at ease. Adopting the show-tell-do methodology in your procedures, along with communication throughout the process at the child's level of understanding, is key. I'm sure these tips will be helpful to you when performing endodontic procedures on children. The effect you can have on the initial procedure and eventually their adult dental health is very rewarding.